Teresa, there are concerns the distribution of the COVID vaccine may not be as equitable and efficacious as bioethicists would have hoped. As you see it, is the vaccine being distributed ethically and equally? Are there any groups you wish had priority over others?
Oh, thank you for that question. I think that the priorities that the CDC has put together are ethical priorities. The devil is in the details. So one question is, of course, we all want to reduce death and serious disease. The other one is we want society to keep functioning. But the big concern for many people is how do we reduce the burden that COVID has on populations that are already being more stressed by COVID? And so one thought is, how do we identify these populations? These are often people who are of lower socioeconomic status, they're poor, they may live in multi-generational housing, they may not have access to food and other things. So these communities also often don't have the healthcare infrastructure that we need. So where are the vaccine sites? How do we get this information out to these populations? And are they accessible? These are big priorities for New Mexico.
Let's say you had full control of who got the vaccine and when. How would you make the vaccination effort fairer for all?
That's such a good question. Well, I think that it's, of course, not just up to me. And even if I were told I could make the decision myself, I would ask and include members of the populations who feel that they have been disregarded. But one thing I think is important to do is to consider where are these sites located, but maybe even before that, what's the infrastructure? Do we have enough of the vaccines in particular areas, especially communities that have been hit hard? Vaccine locations that are easily accessible to people, not just in terms of are they on a bus line, do people have cars so they can get there, but also what about people with disabilities? Is there signage for deaf people who may not be able to speech read because people are wearing masks? Do we have entrances and exits with ramps rather than stairs? And this is actually a problem with one of the sites. I was just notified of this yesterday. Do we have information that's accessible to people before they get on site, so that they know what to expect and what to anticipate? So these are some of the things that are important to people with disabilities that haven't really been considered, not just here in New Mexico. I think New Mexico is doing a pretty good job, but nationally.
And we take it you have a copy of President Biden's national COVID response. Is there anything promising in the plan? Anything surprising?
Well, I'm excited about it. It does take specific note of people who are what we call under the social vulnerability index category. I mean, everyone can be assigned certain kinds of vulnerabilities depending on where they live, what kind of resources they have access to, and so forth. And the Biden plan has a particular effort to make sure that these populations that are often overlooked are not being overlooked. There's a lot of attention being given to those communities. And as a bioethicist, one of the things I look at are values, and how are the values of the American people represented in such a document? How do these get manifested in the choices and the priorities, and whose lives and well-being are prioritized when there's so many competing interests, whether it's economics and education and, of course, health and well-being.
Do you feel like the document represents that?
So it's 200 pages long plus, and I read through it very quickly a few nights ago. I didn't see any flags, so I'm encouraged and hopeful. I will later this week be going through it with a fine-tooth comb and then making recommendations to various people about my thoughts on this. And in particular, since I do a lot of work with disability communities, we'll look for how this supports and provides acknowledgement of the needs of people with disabilities.
Let's compare what's happening in New Mexico versus other states. Is there anything we should be modeling or anything we should be avoiding?
Well, actually, I think New Mexico's doing a really good job. I'm most familiar with what's happening in DC and Maryland and Virginia, because that is another place where I spend a lot of time and I'm familiar with that community. One thing that New Mexico has done differently than a lot of states is in the most recent vaccine allocation plan, which is dated January 22nd, New Mexico actually makes specific reference to verification of employment and of qualifying conditions. And I asked around, because I was told this might be a topic that would come up, and I asked colleagues around the country and got some input also from international bioethicist colleagues. And what they've said is this is very much an honor system in most locations. Now, whether that will change remains to be seen, because these vaccine allocation plans are shifting as we learn more about what works and what doesn't work. But I was very pleased to see that in New Mexico, there is going to be verification of employment, and then also that people with qualifying conditions should be prepared to verify medically what their conditions are. And of course, this is tricky because it gets into issues of medical privacy. So we have to be careful about that.
There have been reports of people line jumping the vaccination process. They're sharing event codes meant for healthcare workers on the registration portal. And coupled with that, the system does rely on people to be truthful. Do you think these safeguards, I guess we'll find out, but you think that we have them here, but that's not necessarily universal right now around the country?
Not at this point. So again, I asked a number of colleagues about this in states in the Northeast, Southeast, West Coast, and Midwest. And everything that I received said, so far it's honor system. Now, line jumping, I think no matter what the context is, we'll always have a few people who do that. It's part of the free rider problem, if you will. But I think that we have to wait and see, is this a problem that is a systemic issue? If so, then we really should fix it. Is it a once in a while thing? If it's a once in a while thing, is this the best way for us to allocate our very limited resources in public health? So it's partly, I think, a matter of how do we distribute the resources we have in the most effective ways. And that may not be the best use of our resources at this point in time.
Because verifying also takes resources and time. And
and it takes it away from the work that our public health, Department of Health workers and those who are in supportive contexts are doing.
So the New Mexico Department of Health is aiming to vaccinate people with at least one chronic condition in this phase. That includes conditions that could be hard to verify, like smoking or your BMI, your body mass index. Should we be putting people who say smoke as one of those conditions ahead of someone who has a serious crippling neurologic disorder?
Okay, so I am not a medical doctor. I'm a bioethicist, so I'm not going to be able to make judgments about which medical conditions are more risky. The CDC has done that, and ACIP, the Advisory Committee for Immunization Practices in the CDC, has looked at these conditions. And my understanding is that this list is shifting as we get more scientific information. Again, that's a question for the scientists. But the question you just asked me is, when you have conditions that are hard to verify, how much weight should we be giving people in terms of their self-report? And I think, again, this is going to be, it's tricky. I think it's a matter of balancing the resources that we have. What's the best use of our resources? Do we have the capacity to do this? And again, if we find that it's a systemic problem where somehow we're learning about many, many, many people who are doing this, then we'd have to add other safeguards. I actually don't know, because I couldn't find my previous draft copy of the vaccine allocation plan, but it might be worth exploring to see if there was verification language that was different on earlier drafts of this particular plan. And I did not see anything about verification in the most recent CDC website about vaccines. Doesn't mean it isn't there, but I looked for it and I couldn't find it. So perhaps this will be an issue that comes up later.
As they respond to imperfections in the system,
yes.
which happens in a lot of systemic rollouts. Well, Teresa, thank you so much for talking with us about this.
Oh, thank you. Absolutely my pleasure. Thank you.